At a backyard barbecue, a burned forearm gets 3 different remedies in under 10 seconds. The butter goes on, the ice follows, and nobody stops to check if either actually works. American first aid is less about medicine and more about family folklore. We repeat what our grandparents did because noisy confidence feels much safer than looking up the actual protocol. But what happens when the gap between folk wisdom and reality actually matters? The file on everyday medical myths is officially open. 1. Every Thanksgiving, someone in the kitchen repeats the same advice about minor burns. And every time it is wrong. Slathering butter on a hot stove, burn traps the heat against the skin, actively cooking the tissue longer. The remedy survives not because it heals, but because the greasy sheen makes it look like a legitimate medicinal ointment. 2. Hydrogen peroxide fizzes instantly on a scraped knee, which convinces parents everywhere that it is working. That satisfying bubbling action is actually the chemical destroying healthy skin cells alongside the bacteria. The wound takes twice as long to heal, but the visual theater of the foam makes the amateur medic feel like a certified professional. 3. Despite being wrong for at least 40 years, the head tilt nosebleed move still wins every argument. Tilting the head back does absolutely nothing to stop the bleeding. It just redirects the blood down the back of the throat. The person ends up swallowing it, risking nausea, while the actual blood vessels in the front of the nose remain completely uncompressed. 4. By the time the hiking group realizes a snakebite has occurred, someone is already trying to suck the venom out. Hollywood convinced an entire nation that the human mouth is a sterile extraction device. In reality, the venom enters the bloodstream instantly, and the amateur hero just introduces massive amounts of oral bacteria into an open wound. 5. Inside a dusty garage, a severed finger is immediately dropped into a cup of solid ice. Freezing an amputated digit directly on ice crystals causes severe frostbite to the remaining healthy tissue, rendering it useless for reattachment. It needs to be sealed in a plastic bag first. But panic always skips the intermediate steps. 6. If someone swallows poison, the immediate panicked instinct is to force them to throw it back up. Inducing vomiting with chemicals like syrup of ipecac forces caustic substances back up the esophagus, burning the throat a second time. The outdated remedy causes double the internal damage while everyone stands around waiting for a physical result. 7. A well-meaning coworker insists that rubbing alcohol will bring down a sudden fever. Wiping down the skin with isopropyl alcohol causes rapid cooling that triggers violent shivering, which actually raises the core body temperature. The outdated trick also absorbs through the skin, introducing mild toxicity to a system that is already struggling. 8. The tourniquet goes on before anyone checks where the bleeding is actually coming from. A tight belt gets cranked down over a knee for a superficial scrape, completely cutting off circulation to the lower leg. The dramatic Hollywood-style intervention turns a minor cut into a major circulation crisis just because someone wanted to be the hero, eh? 9. 2 lifeguards disagree on a jellyfish sting while the victim waits in agony. The persistent myth that urine neutralizes the sting is entirely false. Human urine alters the salinity around the wound, causing the remaining microscopic stingers, called nematocysts, to aggressively fire more venom into the skin. 10. When someone feels faint, the immediate crowd reaction is to quickly prop them up into a sitting position. Forcing a fainting victim upright forces their heart to pump blood back up to the brain against gravity. Leaving them flat on the floor looks entirely unhelpful. But it is exactly what the cardiovascular system needs. 11. A mother blows softly on her child's scraped elbow to make the stinging stop. The gentle breath provides temporary cooling relief, but it also coats the fresh abrasion in a microscopic layer of oral bacteria. The instinctive act of parental comfort accidentally increases the risk of a localized infection. 12. Raw steak lands on the black eye like a medical tradition nobody ever verified. The guy holds the dripping meat to his bruised face, completely ignoring the bacteria seeping into the microabrasions around his swelling eye. While 2 onlookers stare in absolute horror, a bag of frozen peas would have actually reduced the swelling without the hygiene risk. 13. During a restaurant panic, Someone is desperately trying to pull a choking victim's tongue forward. Reaching into a choking person's mouth blindly usually just pushes the obstructing object deeper into the airway. The frantic finger sweep maneuver survives because doing something with your hands feels better than doing the correct thing with your forearms. 14. Because it looks dramatic, hyperventilating into a brown paper bag remains the go-to advice for a panic attack. Rebreathing carbon dioxide can actually trigger worsening oxygen deprivation in the brain. The person just feels dizzier, but the visual prop makes the bystanders feel like they have successfully managed a psychological crisis. 15. A high school athlete sprains an ankle, and the coach immediately orders them to walk it off. Putting immediate weight on a freshly torn ligament guarantees prolonged structural damage. The old-school toughness doctrine actively ensures the player will be limping for 3 months instead of 3 weeks. 16. Whenever someone starts seizing on the floor, a panicked bystander dives to shove a wallet into their mouth. The myth that someone can swallow their own tongue is anatomically impossible. Forcing objects between violently clenching teeth usually results in broken molars and a blocked airway, compounding the original medical event. 17. Coffee grounds get packed onto a deep kitchen knife wound to stop the bleeding. The porous grounds absorb the blood and create a makeshift scab, but they also embed hundreds of tiny foreign particles directly into the laceration. The emergency room nurse then has to spend an hour scrubbing out a homemade espresso bandage. 18. Inside a Little League dugout, the coach reaches for chewing tobacco to treat a bee sting. Slapping a wet wad of tobacco onto a sting is an old rural remedy that simply introduces nicotine and oral bacteria to punctured skin. The swelling continues, but now it smells terrible. 19. If the burn victim is lucky, someone grabs cold water, but usually they grab a bag of frozen ice. Applying ice directly to a severe thermal burn causes rapid cellular constriction, damaging the tissue through extreme cold immediately after it was damaged by extreme heat. The skin suffers 2 completely different temperature traumas in 5 minutes. 20. A coworker gets a piece of grit in their eye, and someone immediately suggests rubbing it gently to produce tears. Rubbing the closed eyelid grinds the microscopic debris directly across the sensitive cornea. A simple flush with tap water is rejected in favor of an action that causes permanent scratching. 21. After a mild concussion on the playground, a parent insists the child cannot be allowed to fall asleep. Keeping a concussed person awake through aggressive prodding does not prevent brain damage. The brain actively needs sleep to heal, but the fear of a coma makes people choose sleep deprivation over recovery. 22. 3 people crowd around a tick embedded in an arm, holding a lit match to it. Burning a tick forces the insect to regurgitate its stomach contents directly into the host's bloodstream before it dies. The attempt to remove the bug quickly guarantees the maximum possible transfer of disease-causing pathogens. 23. Before the ambulance even arrives for the broken leg, someone is already trying to forcefully straighten the bone. Realigning a severe fracture without medical imaging can sever nearby arteries and nerves. The urge to make the limb look normal again supersedes the basic reality of internal anatomy. 24. A bottle of generic eye drops is passed around the office to treat a case of pink eye. Using anti-redness drops on a bacterial infection only masks the visible symptom by constricting the blood vessels. The infection continues to spread silently, while the user confidently assumes they are cured. 25. Someone at the gym insists that stretching a suddenly cramping muscle will immediately fix the knot. Aggressively pulling on a muscle experiencing an active spasm can cause micro tears in the muscle fibers. The cramp eventually releases, but the forced stretching leaves the leg sore for days. The file is barely open. We have covered the household habits and the backyard improvisations, but the absurdity is about to become official. When confident amateurs enter the workplace and the public square, the bad advice becomes a system. 26. In the break room of a regional bank, the first aid kit has not been opened since the late 90s. It is full of expired aspirin that has chemically degraded into a useless powder. The company relies on the presence of the white box rather than the actual viability of the medicine inside it. 27. A rusty nail goes through a boot. and the foreman insists that simply letting the wound bleed out will cleanse the tetanus. Tetanus is a bacterial neurotoxin that does not wash out with a little blood. The tough guy workplace remedy completely ignores how microscopic pathogens actually function. 28. Half the parents on the sideline are convinced that an inhaler can be shared during an asthma attack. Using someone else's prescribed rescue inhaler delivers an unknown dosage of corticosteroids that may not match the victim's needs. The medical shortcut treats prescription devices like communal water bottles. 29. When the office worker feels a sudden chest pain, they are handed a glass of water instead of an aspirin. Chewing an aspirin immediately during a suspected heart attack inhibits blood platelets from clumping, potentially saving the heart muscle. The water does absolutely nothing, but it feels polite. 30. A construction worker gets a chemical splash on their arm and instinctively tries to neutralize the acid with a base. Mixing an alkaline substance onto an acid spill directly on the skin causes an exothermic chemical reaction. The amateur chemistry experiment generates intense heat, causing a thermal burn on top of the chemical one. 31. At the community pool, the lifeguard station still stocks rubbing alcohol for earaches. Pouring straight alcohol into an inflamed ear canal causes agonizing pain without treating the underlying middle ear fluid buildup. The stinging sensation is mistaken for a cure just because it hurts. 32. Someone swallows a fishbone at a dinner party, and the immediate advice is to swallow a massive chunk of dry bread, forcing a solid mass down the esophagus. To push a sharp object often just drives the bone deeper into the tissue. The mechanical solution completely misunderstands the fragility of the throat. 33. A teenager pops a blister from new shoes because it looks unsightly. The fluid inside an intact blister is actually a sterile, protective cushion created by the body to heal the skin underneath. Piercing that barrier turns an internal healing mechanism into an open, highly vulnerable wound. 34. Every summer, someone at the lake pulls a fishhook out the wrong way. Yanking a barbed hook backwards simply tears the flesh further. The counterintuitive but correct method is to push the barb entirely through the skin and snip it off. But nobody wants to push a hook deeper. 35. A coworker faints and someone immediately rushes to waft smelling salts under their nose. The sharp ammonia vapor triggers an involuntary inhalation reflex, which forces the person awake but can severely irritate the respiratory tract. The outdated Victorian revival method is entirely unnecessary for a simple drop in blood pressure. 36. Because the bandage keeps getting wet, a parent decides it is better to let a deep cut simply breathe out in the open air. Exposing a wound to dry air kills the surface cells and forms a hard scab, which actually slows down the cellular regeneration beneath it. Wounds heal faster in a moist, covered environment. 37. A hiker gets a patch of poison ivy, and a friend vigorously scrubs the rash with soap and hot water. Hot water opens the pores of the skin, allowing the urushiol oil from the plant to absorb even deeper. The aggressive cleaning routine rapidly accelerates the allergic reaction. 38. Whenever someone gets a sudden nosebleed, a helpful bystander pinches the bridge of the nose right between the eyes. The blood vessels causing the bleed are located much lower. In the soft cartilage, pinching the hard nasal bone accomplishes nothing except making the person look intensely frustrated. 39. A child bumps their head, and the immediate response is to apply a warm compress to soothe the pain. Heat increases blood flow to the affected area, which aggressively accelerates the swelling and inflammation. A cold pack is ignored because warmth feels emotionally more comforting. 40. At a noisy restaurant, someone starts coughing violently, and a friend immediately starts pounding them on the back. Hitting the back of a person who is actively coughing can dislodge the partially blocked food and drop it straight into the airway, completely sealing it. A partial blockage is accidentally turned into a fatal emergency. 41. Two neighbors disagree on a deep splinter while the victim waits. One neighbor digs frantically with an unsterilized sewing needle, guaranteeing a secondary infection. The microscopic rust and household bacteria on the needle are far more dangerous than the tiny sliver of wood. 42. A A person hyperventilating is told to breathe deeply into their chest to calm down. Chest breathing actually engages the secondary respiratory muscles, increasing the feeling of panic and breathlessness. The correct intervention is diaphragmatic belly breathing, but chest heaving looks more dramatic. 43. A gym coach insists that a heat-exhausted athlete immediately jump into an ice bath. Shocking a severely overheated body with freezing water causes the blood vessels in the skin to clamp shut. This traps the extreme heat deep in the core organs, turning heat exhaustion into life-threatening heat stroke. 44. Someone finds an old bottle of syrup of ipecac in the cabinet and keeps it just in case. The medical community officially stopped recommending the vomiting agent 2 decades ago because it causes more harm than good. The bottle remains on the shelf because throwing away medicine feels strangely irresponsible. 45. A driver gets a minor whiplash injury and immediately throws on a rigid foam neck brace found in the trunk. Immobilizing a mild neck sprain for days weakens the supporting muscles and delays the healing process. The visible armor feels safe, but the physical reality requires gentle movement. 46. A family member insists on treating a sunburn with a thick layer of petroleum jelly. The heavy, non-breathable jelly traps the residual heat radiating from the damaged skin. The soothing gel essentially acts as a greenhouse, baking the sunburn for another 6 hours. 47. Whenever a tooth gets knocked out at a ball game, the clock starts, and someone inevitably wraps it in a dry napkin. The periodontal ligaments on the root die quickly in dry air, making reimplantation impossible. The tooth needed to be submerged in milk, but a napkin feels cleaner. 48. A tourist gets stung by a stingray, and a local suggests packing the wound with freezing sand. The venom of a stingray is a protein-based toxin that actually breaks down under intense localized heat. Applying cold preserves the venom, ensuring the agonizing pain continues uninterrupted. 49. A worker gets a deep puncture wound from a rusty wire, and the supervisor applies liquid bandage over the top. Sealing a deep, narrow puncture wound traps anaerobic bacteria at the bottom of the injury. The airtight seal creates the perfect breeding ground for a massive, unseen infection. So, 50. By the 3rd inning, a jammed finger has already been violently yanked straight by 2 different teammates. Pulling a compressed joint does not pop it back into place. It tears the collateral ligaments. The macho urge to reset a bone ruins a joint that merely needed a splint. We have moved past simple household mistakes. The logic is clearly flawed, but the confidence is entirely unshaken. Now we enter the territory where institutional repetition turns terrible ideas into absolute unquestioned law. Let's pause the file. So far, we have witnessed the raw steak facial, the Thanksgiving butter burn, and the backward fishhook removal. But the sheer volume of confident incompetence is about to scale up. The remedies are getting stranger, and the bystanders are getting louder. 51. In a high school cafeteria, a student with a mild allergic reaction is given a double dose of liquid antihistamine instead of an epinephrine pen. Antihistamines take up to an hour to absorb and do nothing to stop a closing airway. The fear of needles overrides the biological necessity of adrenaline. Aranasak, Shansenari. 52. A manager insists that a worker who suffered an electrical shock just sit down for 5 minutes to recover. Electrical burns travel internally along the path of least resistance, meaning the heart rhythm could be fatally disrupted hours later. The lack of visible external damage falsely signals that the crisis is over. 53. Because it fizzes, hydrogen peroxide is poured directly into a deep animal bite. Animal saliva contains complex bacteria that require systemic antibiotics, not a surface-level chemical foaming. The peroxide merely damages the torn tissue, making it harder for the doctor to properly stitch the wound. 54. Someone drops a heavy box on their foot, and a coworker immediately removes the shoe and sock to check. Stripping the footwear removes the structural compression holding the swelling in check. The foot rapidly expands like a balloon, guaranteeing the shoe will not fit back on for a week. 55. A hiker gets a deep gash on a trail, and a companion covers the wound entirely in superglue. While medical-grade cyanoacrylate is used in hospitals, hardware store superglue contains toxic solvents that burn the tissue. The chemical shortcut seals the wound but destroys the cellular edges. 56. Despite all warnings, a parent gives a feverish toddler an adult aspirin cut in half. Giving aspirin to a child recovering from a viral infection can trigger Ray's syndrome, a rare but devastating swelling of the liver and brain. The mathematical shortcut of half a pill ignores profound metabolic differences. 57. A restaurant worker slices their palm, and the manager insists they wrap it tightly to stop the blood flow entirely. A tourniquet-style wrap on a hand cuts off collateral circulation, risking permanent nerve damage to the fingers. Direct pressure on the actual laceration is ignored in favor of wrapping the entire appendage. 58. When someone feels a sudden, sharp pain in their abdomen, a friend offers them a powerful over-the-counter painkiller. Masking severe abdominal pain with medication obscures the vital diagnostic symptoms of a rupturing appendix. The pain goes away temporarily, allowing a localized problem to become a systemic infection. 59. A teenager gets a bad scrape on the asphalt, and a parent forcefully scrubs the wound with iodine. Tincture of iodine is a harsh antiseptic that is highly toxic to exposed subcutaneous tissue. The red stain looks deeply medicinal, but it actively delays the formation of a healthy scab. 60. At a busy intersection, a bystander drags a car crash victim out of the vehicle just to get them to the sidewalk, moving a trauma patient without cervical spine support risks, turning a fractured vertebra into a severed spinal cord. The instinct to clear the scene overrides the necessity of spinal immobilization. 61. A coworker complains of a massive, sudden headache, and the office consensus is to let them take a nap in a dark room. Ignoring a sudden thunderclap headache can mask the onset of a hemorrhagic stroke. The social desire to not be a bother turns a neurological emergency into a quiet nap. 62. Because a dog bite barely broke the skin, the owner simply washes it with soap and ignores it. Puncture wounds from canine teeth inject bacteria deeply into the tissue, where oxygen cannot reach them. The small surface hole closes quickly, sealing a massive infection deep inside the muscle. 63. Yes. A camper suffers a deep cut, and someone suggests packing the wound with damp moss gathered from a tree. The survivalist myth assumes nature provides sterile bandages, completely ignoring the soil bacteria and fungal spores living in the moss. The rugged outdoor remedy guarantees an immediate organic infection. 64. Someone twists a knee during a run, and a friend applies a chemical heat patch right over the joint. The continuous intense heat causes vasodilation, flooding the injured area with excess fluid. The joint swells to twice its size while the runner mistakenly believes the heat is loosening the muscle. 65. A person experiencing a severe asthma attack is told to sip hot tea to relax the throat muscles. Asthma is a lower respiratory inflammation of the bronchioles, not a tense upper throat. The tea does absolutely nothing, but wastes critical minutes before the rescue inhaler is finally deployed. 66. When a minor burn blisters the next day, the instinct is to pop the fluid sac to relieve the pressure. The blister roof is a biological dressing keeping the raw dermis completely sterile. Puncturing it introduces environmental pathogens directly to the most vulnerable layer of the skin. 67. A coworker gets an electric shock from a frayed wire, and someone throws a bucket of water on the sparking outlet. Water is a highly effective conductor of electricity, instantly electrifying the puddle spreading across the break room floor. The attempt to extinguish a non-existent fire creates a secondary electrocution hazard. 68. A student faints from low blood sugar, and the teacher immediately tries to pour juice down their throat. Pouring liquid into the mouth of an unconscious person bypasses the swallowing reflex and goes straight into the lungs. The attempt to raise glucose levels causes immediate aspiration pneumonia. 69. Because the bandage is stuck to the dried blood, a parent rips it off quickly like a wax strip. Tearing a dry bandage violently removes the newly formed epithelial cells, trying to bridge the wound. The quick pull method restarts the bleeding and resets the healing clock back to 0. 70. A hiker gets a heavy dose of pepper spray in the face by accident, and a friend furiously scrubs their eyes with a wet towel. Pepper spray is an oil-based irritant and rubbing it aggressively grinds the capsaicin into the cornea. The towel just smears the chemical across the entire face. 71. When someone starts hyperventilating, the immediate crowd reaction is to tell them to take a deep breath. A person hyperventilating is already overbreathing and expelling too much carbon dioxide. Telling them to take deeper breaths physically exacerbates the exact chemical imbalance causing the panic. Or decide racing 4. 72. A kitchen worker slices a finger, and someone immediately suggests elevating the hand high above the head. While elevation reduces blood pressure slightly, it does nothing to clot an actively bleeding artery without firm, direct pressure. The worker just stands there bleeding onto their own shoulder. 73. A child gets a bee sting, and a parent frantically tries to pinch the stinger out with tweezers. Squeezing the embedded venom sac at the top of the stinger forcibly pumps the remaining toxin directly into the skin. A credit card scrape was needed, but the tweezers felt more surgical. 74. Because an old thermometer broke, a homeowner decides to casually sweep the liquid mercury into a dustpan. Agitating elemental mercury breaks it into microscopic beads that instantly vaporize at room temperature. The casual cleanup turns a minor spill into a toxic inhalation hazard for the entire house. 75. A person suffers a suspected broken rib, and a friend tightly wraps their entire chest with athletic tape. Binding the chest cavity restricts the lungs from fully expanding during inhalation. The structural support inadvertently guarantees the victim will develop pneumonia from shallow breathing. The pattern is no longer just a collection of bad advice. It is a locked system of belief. The final entries in this file show what happens when the absurdity becomes so normalized that attempting the correct procedure actually feels wrong. 76. If someone accidentally drinks bleach, the immediate family consensus is to have them drink a glass of milk to coat the stomach. Milk does not neutralize sodium hypochlorite, it simply mixes with it. The dairy creates a thicker, toxic sludge that the hospital will now have a harder time pumping out. 77. A runner collapses from dehydration, and a coach hands them a massive jug of pure water to chug instantly. Flooding a severely dehydrated system with pure water dilutes the remaining blood sodium levels, causing a dangerous condition called hyponatremia. The brain swells because the aggressive hydration lacked essential electrolytes. 78. When a deep splinter is entirely under the skin, a coworker suggests soaking the finger in baking soda to draw it out. Baking soda simply macerates the skin, turning the tissue mushy and fragile without actually extracting the wood. The home remedy just makes the eventual surgical removal much messier. 79. A child gets a bloody nose, and a parent tells them to blow their nose forcefully to clear out the clot. Blowing the nose violently dislodges the fragile platelet plug that was just beginning to seal the ruptured vessel. The aggressive clearing action guarantees the bleeding will start all over again. Say 80. A camper finds a tick attached to their leg and immediately smothers the insect in petroleum jelly to suffocate it. A tick breathes only a few times an hour and will happily survive in the jelly while continuing to feed. The delayed suffocation tactic just ensures maximum disease transmission. 81. Someone suffers a mild chemical burn from a cleaning product, and a friend immediately rubs an aloe vera leaf on it. Fresh aloe contains natural enzymes that are soothing on a sunburn, but they can aggressively react with synthetic industrial chemicals. The natural cure triggers a secondary dermatological crisis. 82. A person begins to exhibit signs of heat stroke, and a bystander offers them an ice-cold beer to cool down. Alcohol is a powerful diuretic that accelerates fluid loss and further impairs the brain's ability to regulate temperature. The casual social beverage actively pushes the body closer to organ failure. 83. Because a cut looks slightly infected, a homeowner scrubs it with a harsh antibacterial kitchen cleaner. Surface disinfectants are designed for inanimate countertops, not porous human tissue. The chemical destroys the cellular walls of the wound, guaranteeing a massive scar and delayed healing. 84. A worker gets a tiny shard of glass in their foot, and the manager insists on digging it out with a pocket knife. The unsterilized blade introduces grease lint and pocket bacteria directly into the puncture. The glass might have worked its way out, but the knife guarantees a staph infection. 85. A hiker gets bitten by a spider, and a companion confidently uses a knife to cut an X over the bite mark. Slicing open a venomous bite simply creates a larger, bleeding laceration on top of a localized neurotoxin. The cinematic survival trick dramatically increases the required medical intervention. 86. When a person feels dizzy from low blood pressure, a friend immediately hands them a sugary candy bar. Refined sugar triggers a rapid insulin spike, which is followed by an even steeper crash. The incorrect diagnosis of low blood sugar actually makes the dizzy spell significantly worse. 87. A driver gets battery acid on their hands and immediately tries to wash it off with a bottle of drinking water. Small amounts of water applied to concentrated sulfuric acid cause a violent exothermic reaction that boils the liquid on the skin. The lack of a high-volume flush turns a splash into a severe burn. 88. Someone gets a deep, jagged cut, and a coworker confidently pours whiskey over it to sterilize the wound. Commercial liquor is roughly 40% alcohol, which is high enough to burn the tissue but far too low to reliably kill hospital-grade bacteria. The cinematic gesture causes agonizing pain for zero medical benefit. 89. A teenager gets a minor burn and follows an internet myth by immediately applying plain white toothpaste. Toothpaste is packed with abrasive silica menthol and artificial flavoring that violently irritates exposed dermal layers. The minty crust hardens over the burn, sealing the heat inside. 90. A person accidentally superglues their fingers together, and a friend tries to forcefully pry them apart. Yanking cyanoacrylate bonds apart rips the top layers of the epidermis completely off the fingers. Acetone would dissolve the glue painlessly, but brute force always feels like the fastest option. The file is closing, but the logic remains stubbornly intact. The final tier of myths survives because they sound exactly like something a tough, practical person would say. And in America, sounding practical is always more important than being right. 91. If someone swallows a small coin, the immediate parental reaction is to give them a laxative to speed up the process. Forcing rapid, unnatural bowel movements can cause the metal object to turn sideways and impact the intestinal wall. The chemical shortcut aggressively turns a waiting game into an obstruction in it. 92. A worker gets a tiny metal filing in their eye, and a coworker suggests using a strong magnet to pull it out. Waving a magnet near the cornea can violently drag the sharp shard horizontally across the delicate surface of the eye. The clever mechanical solution causes catastrophic internal scratching. 93. Because a sprained wrist is swelling, a coach immediately wraps it in a tight elastic bandage and leaves it on overnight. Continuous compression while sleeping allows the swelling to cut off arterial blood flow entirely undetected. The player wakes up with a throbbing, dangerously numb hand. 94. A camper suffers a deep puncture from a rusted tent peg, and a friend aggressively squeezes the wound to bleed out the dirt. Forcing pressure around a puncture can actually push the microscopic contaminants deeper into the surrounding muscle tissue. The squeeze technique accomplishes the exact opposite of its intention. 95. Oh, when someone feels a sudden chest tightness, a coworker suggests they do a few jumping jacks to get the blood flowing. Forcing cardiovascular exertion on a heart that is potentially experiencing ischemia dramatically increases the oxygen demand on a failing muscle. The attempt to shake it off triggers a massive cardiac event. 96. A hiker gets a patch of poison oak, and a companion suggests scratching the blisters to let the poison out. The fluid inside an allergic blister does not contain the plant oil, but breaking the skin invites a severe secondary bacterial infection. The scratching satisfies a temporary itch, but ruins the skin barrier. 97. A person gets a mild frost nip on their fingers, and a friend vigorously rubs the hands together to generate friction. Rubbing frozen tissue grinds the microscopic ice crystals directly into the cellular walls, shattering the cells from the inside out. The aggressive warming technique causes permanent neurological damage. 98. Because a child has a high fever, a parent submerges them in a freezing cold bathtub. The extreme temperature shock causes the blood vessels in the skin to constrict instantly, driving the intense heat deeper into the core organs. The aggressive cooling method actively worsens the internal fever. 99. A worker suffers a mild chemical splash to the eye, and the supervisor allows them to flush it for only 30 seconds before stopping. Chemical burns require a continuous, low-pressure flush for at least 15 minutes to dilute the substance. The premature stoppage leaves residual acid to silently erode the cornea. 100. A person steps on a rusty nail and immediately covers the puncture with a thick layer of antibiotic ointment. Heavy ointments seal the top of the narrow wound, preventing oxygen from reaching the bottom. This creates the perfect anaerobic environment for the tetanus bacteria they were trying to prevent. 101. A seizure. Somewhere between the parking lot and the emergency room, the splint got put on entirely backwards. The board was tied over the fractured bone so tightly that it restricted the pulse, while the actual joint remained completely unsupported. The amateur medics stepped back, admired their handiwork, and genuinely believed they had saved the day. A tourniquet strapped over a minor scrape, a piece of raw meat pressed against a bruised eye. The myths survive because we would rather look busy in an emergency than admit we do not actually know what to do. The confidence of an amateur is a powerful, dangerous thing. It takes a lot of effort to ignore the label on a bottle, but we do it every single day. Have you ever confidently given terrible medical advice, only to realize years later how wrong you were? Leave it in the comments, and maybe check the expiration dates in your break room first aid kit.